Okay, so I'll go on to introduce our first speaker. So we're going to begin with Dr. Catherine Preston, who is a lecturer at the University of York. Catherine is a cognitive neuroscientist, and we've been working together for a couple of years now on our research looking at the perinatal period.
Hello, yes, thanks for the introduction, Liz. So I can share that now. Okay, great. Okay, thanks. Yeah, thanks for the introduction. So yeah, as Liz mentioned, I'm a psychologist who has my research specialism has been for pretty much all my career on perception of the body. And I'm interested in how perception of the body influences our feeling of selfhood, our emotions and experiences such as pain. It was about just over 4.5 years ago now, when I found out that I was pregnant with my first child, I thought, hang on, why haven't I looked at pregnancy before? Because it's suddenly all these changes were happening to my body, and like I was thinking, as a body perception scientist, why hadn't I looked at them? And around the same time, Liz Kirk, who was working in the same department as me at the time, also found out she was pregnant with her first baby, and she's a developmental psychologist, so we put our heads together and we started this journey of perinatal kind of research. And we initially started in pregnancy, where we looked at the influence of the feelings towards the body during pregnancy on this bond that women have with their unborn baby. And we developed a scale, the Body Understanding Measure in Pregnancy, or BUMPS, and that we found that was a strong predictor of this antenatal attachment. But then, of course, we gave birth to our babies, and we discovered that obviously these bodily changes don't stop there, that they continue on postnatally. And so we wanted to continue our research along the same lines. And so that's what I'm going to talk to you about today. So I'm going to talk to you about our first early steps, looking at this postnatal research and the influence of bodily experience. But before I start, I'm going to have almost a slight sort of a content warning, just in case anyone is pregnant or planning to be so soon in the audience. That this is a qualitative study asking for accounts from women, and there have been many women have generously shared their postnatal experiences with us. And as a result, it's quite an honest and uncovered view of the postnatal body. And probably also the way that we advertise the study, but also because of the questions we're interested in identifying where we can help women, we might focus a little bit too much on the negative aspects, and there are also positive aspects as well. So I just wanted to kind of highlight that before I get started. So basically, what about these perinatal bodily changes? So as I've mentioned before, that during pregnancy, there's lots of things happen to the body, and this the webinar in her talk in week 1 talked about that bodily changes during pregnancy can incorporate many parts of the body. So as well as the baby bump, you might get water retention and swelling or pain or even acne. And so there's quite a substantial changes that occur there. And importantly, it's been found that our feelings towards the body during pregnancy can be linked to not only antenatal attachment, but also things like depression, anxiety, and breastfeeding duration. But of course, as I said, following pregnancy, there's also the physical act of birth. Now, regardless of whether you have a cesarean section or a vaginal birth, giving birth is very physical, and so it can result in birth injuries and physical injury that can continue on postnatally. And so what I find really interesting about these perinatal bodily changes is that a lot of them are very specific to this particular time in life. So you don't really develop a baby bump at any other point apart from when you're pregnant. And similarly, changes in the breasts in preparation for breastfeeding only really occur at that time. Yet some of these changes that do occur can have lasting effects beyond birth. So specifically looking at the postnatal bodily experience. So again, in week 1, when Liz talked about the pregnancy body experiences, she described a sort of conflict in the literature where some studies suggest that women feel better about their bodies during pregnancy as they get this kind of a release from the normal social pressures about having to worry about a belly, for example, whereas other women feel worse because obviously of the weight gain and other perhaps less desirable physical changes. In the postnatal body experience, there's a little less of a conflict, and generally women are thought to feel a little bit worse about their bodies at this time, maybe not everyone, but in general. And this is thought to, dissatisfaction is thought to increase following birth, peaking at around 9 months postpartum. And importantly, similar to body satisfaction during pregnancy, this postnatal body satisfaction has been also linked to things like postnatal depression and duration of breastfeeding. And I think interestingly, and we discussed this a bit in week 2 when we had talks from both Andrew Mayers and Amy Brown about these expectations women have about this perinatal experience. And it has been suggested that one of the reasons, contributing factors to a negative experience of the body postpartum, is that women don't have a realistic expectations of what a postpartum body looks and feels like. So what did we want to do in our study? Well, there are 2 main aims. Firstly, we wanted to understand a bit about the contribution of the body to postpartum well-being. And we also wanted to identify themes of this postpartum bodily experience. And we did this using a qualitative study, so a survey, an online survey with some open-ended questions. And our sample consisted of 53 women and aged between 26 and 46 years old. So we didn't have any of the younger mums filling out this survey. And whilst we're talking about limitations of sample, I think it's also important to note that this women was predominantly made of higher educated white women. And certainly in light of Dr. Shubi Puttasheri's talk last week, highlighting these cultural and religious influences that might affect how women feel about themselves and their perinatal experience, then it's worth keeping that in mind as a limitation of this research and also much of the research in the field. So 70% of our women had a vaginal birth and 30% C-section. And in terms of time since birth, we had quite a wide variation, going from just 4 days to 62 months, which is over 5 years. And the reason for such a spread is twofold. First, we weren't overly prescriptive about exactly how far postpartum women had to be in order to complete the questionnaire. And if they wanted to many years later, they could complete it. And secondly, within the same survey, we had questions about pregnancy, birth, and the postpartum period. So we had women who were currently pregnant completing the pregnancy about their current pregnancy, but then also wanted to contribute, talking about a previous birth and a previous postnatal period, which may have happened many years before. So 8 of our women were also pregnant at the time. But for the sake of this, it's worth pointing out, I'm only going to talk about the qualitative responses we got for the postnatal period. So what did we actually ask women? Well, we asked them this just one simple question, really. So what were their most significant body changes that they experienced during the first 6 months following birth and how they felt about them? Did the changes have an impact on how they felt about their self or their baby? And if they felt comfortable to do so, could they comment on the support they received during this time and the expectations they had of postnatal bodily changes prior to becoming pregnant? And we invited women to write as little or as much as they wanted to this question. And then in terms of the analysis, we had 2 researchers independently examine the text and identify themes, and then we came together and discussed any discrepancies we had before deciding on our final themes. But in addition to extracting these themes, we also looked at word frequency, which allowed us to have this rather lovely word cloud. And you can see immediately that some words popping out, such as body and baby, but we also get other kind of interesting words that weren't involved in the question, such as weight, birth, breasts, and breastfeeding. And this is really interesting because it can give us an idea about what our women are actually talking about, but we don't really know what they're saying about these things. So that's why extracting the themes is so important. So the first 3 themes that I'm going to talk to you about, that we identified, were quite similar to what we saw during pregnancy, which is quite intuitive. Firstly, there's weight. We saw that big word weight pop out of the word cloud. So in pregnancy, people were worried about weight gain, and here the more discussion was about weight loss, or concerns about that. For example, most significant body change is weight. I find it's a daily struggle to think about what I'm eating as still trying to lose the weight. And I've not lost all the extra weight I gained. I'm disappointed. My clothes don't all fit again, and I feel a bit looser, wrinklier, and grayer. And then the next theme that we identified, and it kind of feeds in from that last comment, and it's because it's quite closely related to the concerns about weight, is that of appearance. So again, during pregnancy, we found this sort of theme, but of course, then they were talking about developing a baby bump and changes during pregnancy, whereas here it was slightly different. So the examples that I've shown you here are, I chose to breastfeed, and my bra size changed from a C cup to a G cup. It was really dramatic increase, and they're never going to go back. Another example is my boobs also went saggy once I gave up breastfeeding, which made me feel unattractive and still does in some ways. So the third theme that we identified, again, is quite similar to what we found in pregnancy, where there we identified a theme of the physical burdens of being pregnant. And here we have physical burdens of the postpartum period. So one example was I was incontinent for several weeks in my first pregnancy and 2 years for my second, which made me feel ashamed and limited me in doing the things I usually enjoy, like running, dancing, jumping around with joy with my kids. And another example is there was one day when I needed to run for the train about 6 weeks in, and I tried to run and my body just wouldn't. It was a very weird experience for me. So you can see, again, they have these physical constraints and which relate to not being able to do things in the same way, maybe things like incontinence, but also the experience of pain. So in addition to these three themes that I've talked about and that were kind of similar to what we saw during pregnancy, there was also an additional theme that we identified, and that we've called body trust. And within that theme of body trust, there are two kind of sub-themes that we've identified. The first one I've called body autonomy, which is sort of a dissociation from the body. And the examples I have here are the depression I felt during my postnatal period was intense. My body wasn't mine anymore. The first 6 months was hard. Even though my bump and stomach went down really quickly, I didn't feel like me at all. And I felt alone and ashamed by my broken body. So you can see here is like a feeling of, it's negative feelings from feeling dissociated and maybe out of control of your body. But on the other side of the coin, within the same sort of trust theme, we found something we've termed body reverence. And this is a feelings of awe and wonderment about what the body has achieved. I have some lovely examples of this, two of which I felt like I was a superhero feeding, that I was incredibly blessed to be the only source of nurture for a little human being. And I'm proud of my body for growing and birthing, sustaining my baby. So this is being proud and happy and amazed by what your body has achieved in producing a baby. And what's really interesting about this point is that the two aren't mutually exclusive. Women could feel both a dissociation of their body and also a sense of awe towards it. And these kind of mixed feelings about the experience of the body are exemplified by my next two quotes. So I have had a really odd relationship with my body since my baby was born. I'm proud of it because it made him, but also frustrated that I can't run after him. And I have mixed feelings about my body. I am proud that I've been privileged enough to carry and birth two children, but scarred physically, and can feel embarrassed about how my body looks and feels now. So you can see that there's this, at the same time, people are having feelings of awe, but also more negative feelings. So what we're also able to do by looking at this data, as well as identify the themes that our women are talking about, we can also get an idea about what factors actually influence those. And the first one that I'm going to talk about relates to one of those big words that popped out, or two of those big words that popped out from that word cloud. So breasts and breast changes and breastfeeding. And I've just highlighted here, like I've just tried to color code some of the different comments that women have made about their breast changes and breastfeeding experience, which relate to these different themes. So you can see there's quite a lot related to weight and appearance. So less happy with my breast appearance, breasts definitely not as firm, but there's also ones related to the physical experience, like leaky boobs and breast pain. And importantly, there's also these feelings about breasts and breastfeeding, which relate to this kind of body or trust. So I was almost fighting against my body in order to breastfeed. My breasts felt like they were for breastfeeding only, so a feeling of sort of dissociation. And probably my all-time favorite comment, I was amazed by the natural wonder of my breasts. So that leads into this, like being amazed that you're able to, in awe that your body's able to feed your baby. So I think that's quite interesting. And obviously breast changes, even women who don't breastfeed still have breast changes following pregnancy. And so how women thought about this and felt about if they wanted to breastfeed and their success or perceived success in doing that really had an impact in general about the way they felt about their body. The other factor that we found to really have an effect on how women felt about their body was another one of those big words we saw pop out from the word cloud, and that was birth. And women were talking about birth injuries, which were continuing to have an impact postpartum, so stitches and tears. Also birth complications, which their feelings about them have continued on again postpartum, examples being premature birth and preeclampsia. Also birth interventions, so and here like unplanned C-sections or the use of forceps, and generally feelings of control or lack of control following birth, and their self-perceived success during birth seemed to have an impact on the way they felt about their body postnatally. And this is quite important, I think, there's a study in 2018, this is quite a large qualitative study, and they suggested that 65% of their women that they had interviewed or they had responses from following birth had identified feelings of failure, and they'd internalized those feelings of failure. And I guess if you think of a woman who postnatally maybe had a difficult pregnancy and birth not quite how they planned, and then suddenly maybe they have some pain they weren't anticipating or struggling to breastfeed, you can quite see how that could build up into a kind of a negative experience postnatally. And the last thing that I'm going to factor that I'm going to talk about is something that I've already mentioned, and I think feeds into all of these things, and that is the idea of expectations. And again, in week 2, we talked about this, and obviously we don't want to scare women, but I think we need to equip women with the information that they need to be fully prepared for what's going to happen to them during pregnancy, during and birth and the postnatal period. And then maybe they won't feel so alone or like they're the only ones who are having these difficulties if they realize that these are relatively common, or perhaps they could have more mitigating steps during pregnancy for to strengthen pelvic floors and things like that. So and these seems to be a really important factor in how women are feeling. But so to summarize, basically we found themes within the postnatal bodily experience that are quite similar to what we saw during pregnancy, so weight, appearance, and physical themes. But we also found that some negative experiences were linked to feelings of the loss of autonomy or control over the body, a dissociation. Whereas positive experiences were linked to feelings of body reverence, so feelings of awe and wonderment about what their bodies have achieved. And what seemed to be really important factors in influencing how women felt about these things are the experience in the birth, their breast changes or breastfeeding experiences, and general expectations, knowing what to expect. So up until now, and as I kind of touched on before I started, I feel like there's been quite a lot of focus on negative experiences of the body in the postpartum time. And so I just want to take one slide thinking about more positive experiences. So here are a few quotes, and this is by no means exhausted from the accounts that we had. I like the first one, particularly the top one. My stomach was obviously different, loose, and had stretch marks, but I didn't care at all, and I welcomed it because it had given me my son. I felt proud of it in a way and was not at all interested in losing weight, dieting, or toning up in the first 6 months because it wasn't important to me. I thought I'd deal with it later after I'd stopped breastfeeding when I'm ready. So this might indicate that at least some people, so similar to pregnancy, feel like they're still released from the normal social pressures about what women should look like, and they find that kind of liberating, and especially enjoying the being with their baby. And there's also other ones which when feeling that there's light at the end of the tunnel for women who have had difficulties, and when they're feeling like they're reigniting now, and they're feeling starting to feel better and more like their beloved bodily self. So it's not all negative, which is good to know. So for conclusions, basically, bodily experience does seem to be important to postpartum well-being. And I think that's clear as well from the fact that women, even several years on, still wanted to talk about their postpartum experiences. That is really important to how women feel at this time. And also, bodily function and bodily appearance are important to how women feel about their bodies. Factors which can mediate how women feel about their bodies at this time include birth, breastfeeding, and obviously expectations about knowing what to expect in terms of these and how difficult these might be. And really, if there's one take-home message from this talk, it's that bodily experience is important. And one thing that really did crop up from this data is that women felt that there was not really much support for this available to them. So there's a few quotes here. So I would have said that there's not much support around losing weight after having a baby, almost as if it's a given you'll be heavier after. Or none of this was ever a talking point with my midwife. I'm angry that women don't get help they need to fix their bodies after birth. I'm angry that we don't get told how to mitigate pregnancy and birth damage to our bodies, so it's a shock when it happens. Now, of course, what I'm not saying, I'm certainly aware that there are many fantastic midwives and health visitors out there that do their best to fully equip women and prepare women for this time. But what these comments show, and these are by no means exhaustive, that this isn't as standard. And I think that there's a danger that we're all so busy trying to tell people that the appearance of your body doesn't matter, which it doesn't, or at least it shouldn't, that we have to be careful that what we're not saying is that how you feel about your body doesn't matter, because it really does. And also, this isn't all just coming from people supporting these women. These women aren't bringing them up themselves with midwives. They're not discussing it. And one of the things that frustrates me a lot working in this area of research is that often feelings towards the body kind of get tied up with ideas of vanity, and which is definitely not accurate. And so I think your experience of your body is a fundamental part of who you are. And so negative feelings about the body it's about feeling comfortable in your own skin and being happy with yourself. So and I think particularly women in the perinatal period, then this is particularly important because their bodies are going through so much, and we have to be mindful of that. So I'm realizing that I'm just kind of going over, so I'm sorry. Just finished with future directions. So what we want to do with this research next is to develop a postpartum mind and body scale. And the reason we want to do this is to try and answer some of the bigger questions, like the role of the postpartum body experience in parent-infant relationships, and maybe mind-mindedness. If you remember from week 1, Elizabeth Means' fabulous talk about tuning into your child. Its role it might have in things like breastfeeding, birth trauma, so use of interventions like forceps and emergency C-sections, interoceptive awareness. So again, Rose's talk last week, talking about awareness of internal bodily signals and the role they may have in caregiving behavior. We want to see what the postpartum body experience might play in that. And then interventions like compassionate focused therapy, mindfulness, and yoga's interventions. Obviously yoga, Nicola will talk about in a minute. And importantly, the duration of postpartum period. How long this might matter following birth, which intuitively might be longer than what's normally considered. So just want to thank the women for who shared their experience, provided us with this wonderful data. And like Liz did in week 1, I just want to thank also our 2 beautiful baby boys, 4 and nearly 4, who have inspired us with this work, and their subsequent siblings who have continued to inspire us and challenge us daily. Sorry for going over, Liz.
Thank you so much, Catherine. That was a really, really interesting talk. We've had lots of questions come through. Just a note to the audience, please use the Q&A function to put your questions to the speakers. So one question we've had is if you have any suggestions for practice for professionals who are working with women in this perinatal period as to how they might best support women.
Um, well, I think initially probably starting up this conversations with women and making sure that there is an opportunity for women to talk about it and have to be able to have that dialogue. And maybe also, as we've said before, trying to give people some ideas, some information beforehand. We don't want to scare women, so to know what they kind of expect, so they don't feel alone with their and ashamed of their broken body. They realise they're not the only one, and this is relatively normal, and there's something you can do about it.
Yeah, that's a really good point. Lots of people have resonated with the things that you've said, and I think can identify from their own experience what they've encountered. And like you said, it's not really out there in the public domain, but what we do see are these celebrities out in their bikinis on the beach a few weeks after giving birth. So, what do you think the media has to do with raising these expectations or giving this really unrealistic idea about the postnatal body?
Well, I think that the media obviously has a big role to play in this for women's bodies in general, but obviously, and I think it's really sad that women during pregnancy in the postnatal period just don't seem to be immune to this. So I think they have a lot of role to play, because unfortunately there is, even though during pregnancy you might not have the same ideal, unfortunately there is still a sort of an ideal pregnant body, which is no extra weight anywhere, just on the bump. And there's often, which I guess is social media issue, so there's lots of accounts of famous women when they become pregnant seem to get criticized for their weight gain, and that's just it's such a shame that women, we have so much pressures all the time, but women then to not be immune to it when they do fall pregnant and have children. It's just, yeah, it's very frustrating. And so I think there's a lot that the media is responsible for, and a lot that they could probably do to try and help that.
Yeah, thank you so much. So I'm just looking at the questions we've had coming through. So somebody's saying that they are an antenatal educator and a hypnobirth teacher, and they've recently added some postnatal sessions where they bring up subjects with couples, noting how important it is to include fathers and birth partners in these conversations.
I totally agree, and it's something that we didn't touch on. I didn't touch on in this talk. I didn't have time to cover it all. But yeah, I think it's how women feel after birth in relation to their partner and in relation to sex and being sexual again. And this is all really important, and that fathers need to understand this as well, or partners, that women who've just gone through such a physical experience might, doesn't mean they don't love them anymore, but they might need some time to physically and emotionally recover in order to feel more like themselves again and engage in kind of intimate activity. And that's something that definitely came up, and I think it's really important to involve partners in this.
Yeah, absolutely. Again, it's about these realistic expectations, isn't it, of pregnancy, birth, and postnatal.